Hi, my name's Abhishek Shah, and I'm the co-founder and CEO of Wellthy Therapeutics. Wellthy is a digital therapeutic company that inspires and enables patients to reverse, improve, or control their chronic condition. And we work actively with large hospital systems, healthcare systems, health insurers, life insurers, reinsurers, pharmaceutical companies, and medical device companies to be able to improve their health outcomes for their patients. We're today live in type 2 diabetes, hypertension, dyslipidemia, heart failure, ischemic heart disease, and soon we're getting into respiratory conditions as well. I'm here to talk about what we're doing because at the end of the day, this is a pandemic where all of us, especially stakeholders within digital health, can contribute. And in that contribution, we at Wellthy have been tirelessly working towards making sure that our patients do not suffer. So, beginning with augmenting our platform to ensure that we're able to manage patients remotely during these difficult times, which was already happening but is now at a larger scale level, to ensuring that we enhance the platform with features that are relevant for this time frame, and obviously working tirelessly with each and every one of our partners, be it healthcare systems or pharma med device companies or insurers, to be able to ensure that their members, their patients, their physicians are all taken care of. And last but not least, each and every one of our team members going above and beyond the call of duty to be able to ensure that patient outcomes are augmented and get better inversely versus actually suffering. That today is the promise that Wellthy Therapeutics brings to the table for every single partner that we have. Frankly speaking, the government has done an incredible job during this time. And in that, I applaud the new telemedicine guidelines that have come at a very brisk pace to be able to ensure that at least during this difficult time, the healthcare community can do something to be able to help patients. But when you start looking at chronic patients, especially those who are with diabetes or cardiovascular conditions and therefore at very high risk, those patients, their voice needs to now be taken into consideration. These patients don't need just an audio or a video consult. They actually need real-time patient monitoring and escalation. They need healthcare to be continually with them. And when you look at the voice of the patient, what honestly matters is patient outcomes, not just patient access. So how can we as a community really start working towards driving clinically validated and proven real-world patient outcomes at scale consistently to our patients, especially when we look at this paradigm shift in the way in which healthcare needs to be operated? That today remains extremely, extremely important priority that we should be considering. In all of this, let's not forget that every single one of us is an important stakeholder to make this reality happen. And as we drive better real-world patient outcomes, as we drive better outcomes in general, and as we drive to ensure those at risk are actually taken care of, we're going to become better, stronger as a healthcare community. My plea is to every single stakeholder in healthcare to partner, because your individual competencies or your competencies as a company cannot possibly solve for this crisis in isolation. And the more we partner, both digital health with digital health companies, digital one or healthcare 1.0 companies with digital health companies, the more we'll be able to come out of this stronger. Stay safe, and let's keep on ensuring that we're here for the bigger picture, which is better patient outcomes.